You are live. Go ahead.
Okay. Hi, I'm Monica Agarwal.
Eliza Pitchwani.
And Jack Moran.
And today we will be answering the question of whether or not robotic surgery is a better alternative to traditional laparoscopic surgery.
So just to begin with some background, conventional laparoscopy is also called keyhole surgery, and that's because it is less invasive than regular open surgery, where tubes or needles are inserted into the patient's body, and CO2 gas is actually used to expand the area to view, and a two-dimensional viewing console is also used to see the inside of the patient so that the surgeon can perform the surgery. Robotic laparoscopy is similar because, first of all, it has the name laparoscopy in it, except the large robotic apparatus actually performs the procedure while the surgeon is sitting at a console manipulating it with what are similar to joysticks. So there are many concerns about the safety of the robot, but there are actually many features on the Da Vinci and Zeus robotic systems that are much better than regular laparoscopy. For example, it has a three-dimensional viewing console instead of the typical two-dimensional in laparoscopy, and that makes it much more accurate and clear for the surgeon when they are performing the surgery on the patient. Also, the robotic hands do not tremble like surgeons would after a long time, and this also increases accuracy and stops small mistakes from happening that could be the difference between life and death of the patient. And because of the increased precision, the mortality rate of robotic laparoscopy is significantly lower than that of conventional laparoscopy, and there's also less blood loss and a shorter recovery time. So as for analyzing the difference between 3D and 2D views in surgery, a group of medical students inexperienced medical students were assessed on their use of both types of surgical procedures to perform very simple tasks with both types of laparoscopy and robotic surgery. And as you can see, in all the trials, robotic laparoscopy significantly was higher in ambidexterity score, which means that they were a lot more accurate and precise with their procedures.
On top of this, sometimes there are concerns with laparoscopy, robotic laparoscopy, about whether or not the robot will malfunction during the surgery and cause the surgery to go awry and in a very poor outcome on the surgery. And although these concerns are possible, it's been found in an FDA study over about 10 years or so from 50,000 laparoscopic surgeries from a robot that only 177 of the cases in that malfunctioned. And during most of those cases, they were able to fix the robot and continue performing the surgery as if nothing had ever happened.
With obviously safety concerns, another issue that arises is the legality of using robotic laparoscopic systems. As Jack mentioned, there have been complaints made to the FDA about malfunctioning. Some patients claim that the robotic laparoscopic surgery was what led to punctured organs, cuts made in places that were inadvertent and should not have been made, such as to the ureter, or uncontrollable bleeding. However, in an article written by USA Today, the author compiled a list of complaints against the FDA and noted that many of these complications had actually occurred up till several months after the surgery, indicating that the surgery itself may or may not have truly been the cause of some of these symptoms, some of these negative symptoms. Although the FDA did evaluate its approval of the Zeus and the Da Vinci systems throughout the process of these complaints being made, they made a stance that submission of a report to the FDA does not necessarily indicate a faulty or defective medical device. They took the stance due to the report that these injuries had been occurring up till months after the surgery. So although there are definitely safety implications to consider, robotic laparoscopic surgeries do clear all legal problems, and in terms of ethics, it's fine by the government.
So another advantage of robotic laparoscopy is telesurgery, which is also called long-distance surgery, because essentially what happens is that in this type of surgery, the surgeon who is performing the procedure is not in the same room as the patient who is getting the procedure done on them. And so this is pretty much impossible with regular laparoscopy because the surgeon is the one who is actually performing the procedure on the patient, and thus they have to be there to, use the tools and work inside the patient's body. However, in robotic laparoscopy, the actual robotic system is performing the surgery while the surgeon can be in a different room or even in a different city performing it by just looking at the three-dimensional console and being there with the maneuvering station. So in a study in the Journal of Medical Robotics and Computer-Assisted Surgery, the researchers found that telesurgery with robotic laparoscopy is completely feasible, and even latencies in the connection between the maneuvering system and the actual robot did not have any effect. And this shows that telesurgery is completely possible for the future, and in some cases it is necessary because patients cannot receive the treatment that they need because they are too far away from the surgeon that they need the treatment from, or they're not in the right environment. And so this can be extremely beneficial to those who need a specific type of procedure at a specific time.
Now, some of the problems with this is that the public know very little about robotic laparoscopy and telesurgery. And because of that, it's caused magazines like the New York Times to actually have a couple articles bashing robotic laparoscopy. Specifically, an article by Tiff Layer, I believe it was, stated that they were unable to actually talk to the company Intuitive Surgery, and because of that, they had a few problems with their laparoscopic surgery done by a robot. However, in the recent years, the company has actually added a faculty answered questions section to their website that talks extensively about the robot and about its function and its abilities to perform telesurgery.
The advancement of telesurgery the advancement of telesurgery and additional robotic techniques also bode well for patients who may or may not be able to receive treatment in hospitals or places necessarily where they need it. Especially recently with an immigration ban preventing people from traveling, especially even people who may need care in certain hospitals, certain treatments. Further advancements in this technique may eliminate that problem entirely. As far as the costs of surgery,
Keep going.
okay. There have been many arguments made that robotic systems are expensive, which is true. A single unit for the Da Vinci robot or the Zeus robot can cost between $1 billion to $2.5 billion. $2.5 billion. However, many of these articles neglect to mention that additional costs related to surgery would also heavily decrease as a result. For example, out of the costs associated with surgery, the ones that would increase due to robotic laparoscopy would be the physician fees and the surgical implants. However, the associated costs of surgery that would decrease include the cost of the operating room in time, the cost of medications, the cost of the room in which the patient recovers, the cost of hospital care after recovery, and therapy. As an old saying goes, time is money, and the amount of time that a patient gains back in recovery and ability to work again, to function again after surgery, the value of that will, especially in long-term considerations, greatly exceed the costs that hospitals expend now by buying robotic systems.
So the U.S. Department of Health stated that there's around a 0.1 to 0.5 chance that a complication will occur with the use of a robot in laparoscopy. However, the many controversies that have occurred recently regarding their use does not align with this, and that is because of something called the learning curve. Essentially what this is that surgeons take a lot more time to adapt to this new system because it is very modern technology and it has not been seen before its use. In fact, a research article stated that 100 to 150 procedures need to be done, 150 to 250 procedures need to be done by a surgeon in order for them to be considered proficient, and the learning curve is present in around 100 to 150 procedures. This shows how it takes surgeons multiple tries and multiple years of experience to actually do the surgery correctly and be proficient at it. In fact, this graph shows how when inexperienced medical students used both types of laparoscopy, they were the time and scores of the procedure were a lot lower at the beginning for robotic laparoscopy because it was just too new of a technology for them to understand at first. However, with 2-hour training intervals, they significantly increased their scores, and this shows how it simply needs time and experience for them to actually understand how the robotic surgery works.
On top of this, being undertrained for robotic laparoscopy can cause several complications during the surgery. One example of this is as they were performing robotic laparoscopy, the robotic arm actually got stuck inside the patient. Eventually, the robotic arm was removed and replaced, and the surgery went on as originally planned. However, the robotic arm being unable to move was due to improper preparation of the arm. Therefore, with proper training, that surgery would not have gone awry. Therefore, proper training is necessary in order to use the robot correctly.
As going with the theme of additional training, a study conducted by the New England Journal of Medicine stated that doctors, surgeons, physicians need approximately 150 hours, if not more, of training to become experts in using robotic laparoscopic systems. However, currently it is up to a hospital to decide when the surgeon is an expert. And an article written by Dr. Montgomery, I believe, stated that currently surgeons are not getting the 150 hours that is recommended for them to become experts. Rather, surgeons will get between 50 to 100 before the hospital decides to no longer expend any additional money on training the doctor, and they are deemed as experts. Furthermore, the robotic systems, when doctors are trained with them, are treated as tools. However, as you can see here, it is the same robot arm simply holding different tools. However, that is not the definition of robotic surgery. The robots, the Zeus systems, the Da Vinci systems that operate the different tools, operate tools themselves. However, just like a doctor receives different types of training to perform different types of surgeries, the doctor must receive different types of training to perform different types of robotic surgeries. Right now, there is no specialized training, there is no guidelines or regulations to ensure that the proper amount of training is taking place. However, once this is achieved, we do believe that robotic laparoscopy is a better alternative to traditional laparoscopy.
(1304). Questions, please.
Jack, what is a way in which your team's resolution makes you think differently about your own individual research?
Can you repeat the question, please?
Absolutely. What is a way in which your team's resolution makes you think differently about your own individual research?
Well, our team's resolution, as you may have known, was that the robotic laparoscopy was would be a good thing to invest in the future. However, currently it needs more regulations and more knowledge about it. As I was looking through my research, I kind of was leaning towards the end of against laparoscopy because there were many cases where the failures of the robot were unreported or underreported in hospitals. However, after learning about the resolution, I looked a bit deeper into my research and found that they were omitting many details in the articles they were writing, so I switched to find some more peer-reviewed resources and things from the FDA, and that kind of changed my outlook on the research and the robot itself.
Annika, how did the group decide to include one of your group members' perspective/lens/conclusion in the overall presentation?
Okay, well, our group conclusion was that robotic laparoscopy was better than traditional laparoscopy. But the specific solution actually came from Eliza's research. Eliza found an article that talked about a learning curve. Most articles said either this is bad or this is good, but when she found the article about the learning curve, we started to look more into articles that said, maybe it's not great right now, but it will get better, and that influenced her overall conclusion.
Eliza, what is an example of a compelling argument from one of your peers' individual reports that you decided to exclude from your team's presentation, and why?
Well, I remember that at the beginning of our research, Annika did mention in her economics report that these systems are very, very expensive to install at first. So we didn't include that information because we realized that although these are very expensive at first, there are many long-term benefits that can actually help these hospitals gain more profit in the long run, and that's why we decided to exclude the information.
Good job.